Hello, everyone. Good evening to you all. I hope you are all doing good.
Good
Thank you.
evening.
Good evening. Good evening.
Good
Good
evening.
evening. Thank you. Thank you for joining.
How are we doing?
We're good. We're good. Thank you so much. How are you doing?
Oh,
How
I'm
are you
doing
doing?
well by the grace of God. How is the
Amazing.
new baby doing?
She's doing great. And you already know roller coaster right now.
I
I
know,
don't want it to
right?
cry because but thank you for joining.
Thank you for having me too.
Thank you. You're looking amazing. Hello, everyone. This is Speak Out, breaking the silence of abuse. And this is Mental Health Awareness Month. So I want us to use this opportunity to really talk about mental health and, raise awareness so that people will be aware of what is going around. Okay,
Yeah.
so tonight my guest is Lady Phyllis Boachi. She has been with us many times, and tonight I want us to talk about bipolar. We will do just half an hour today,
Yeah.
and then if we don't finish, we'll continue next time with other people together as well. But thank you, Lady Phyllis. How are you doing? How is everything
I'm
going?
doing great. It's a bit hot, but hey.
Where you are, yeah.
Yeah.
It's good. That's good. Yeah, here too. A bit windy, but it's all right.
Yeah.
We
It's
can't
better than
complain.
the cold, so
Definitely,
yeah.
definitely, we can't complain. And I know you traveled to Ghana. How was it?
It's all right. Ghana is expensive, so
Definitely.
but yeah, it was fun. It was fun, but
Okay.
expensive. Yeah.
I'm glad you had fun. That's good. That's good. Okay, so let's get quickly into our topic tonight. I want us to discuss about bipolar because I think sometimes we think a lot of people know what mental health or mental illness is in our community. Some people don't want to talk about it. I realized when I posted even on my page, somebody was like, "We are not mad," and I'm like, "Mental health and mental it's not about being mad. All of us do go through sometimes you don't even know. So you need to
Yeah.
take care of yourself and make sure that you are in a stable place." So tonight I want us to talk about bipolar. Um, for you, what is bipolar disorder and how different like the different mood swings of bipolar? What is bipolar in general?
Okay. So in simple terms, bipolar is just a term referring to extreme mood swings. So the key word here is extreme.
Extreme.
Okay, because every individual, every human being on this planet has got mood swings. There are times You are happy, excited, you are elated, you're all over the place, as people will
Yes.
say. And there are times that you feel low. However, when it comes to bipolar, it's extreme. So if someone is experiencing bipolar, there's two. So when we say bipolar, it means two, bi, okay? And then polar, extremities, okay? So you have two types of moods. You've got the hypomania. You've got the maniac, and then you've got the hypomania. And then you've got the depressive side of it.
Okay.
Okay. So you find out that people that have bipolar, for at least a week, they are happy, they are elated,
Mm.
they've got, they would say, mouth diarrhea, they've got a lot of thoughts. Some of them might get anxious. There are other ones that might have hallucinations.
Mm.
They've got excessive energy. Their thoughts of train is all over the place.
Mm.
Mm, Sometimes you might find out that they've got this delusion of being able to do so many things because they've got too much energy. And that's I don't know how to explain it
Yeah.
to experience it. Okay.
Okay.
And then you have the depressive side where they are low in mood, they don't want to engage, they are isolative, they don't want to talk to anyone. Some people do not eat, they do not
Mm.
engage in any sorts of
Anything.
activities of daily living. So that's what bipolar is extreme mood disorder.
Disorder.
I know in our community, people will say we are not mad. Madness is a very old term that was used to refer to people that had mental health issues.
Mm.
However, every individual on this planet born of a woman has experienced one or the other, one form of mental illness. The
Mm.
only difference is they are able to bounce back.
Mm. That's right.
Right? They're able to bounce back. However, there are some people that are not able to bounce back and require a bit of an intervention to be able to live with mental illness.
Amazing. I mean, I
Yeah.
like that. I like that explanation so that people understand that we all go through sometimes, but we are able to bounce back. That's why
Yeah.
we are where
The
we
only
are.
difference between us and other people that might end up in hospital, or other
Yeah.
people that might their experiences with mental illness might show, is because they are not able to bounce back.
Okay. Yeah.
Yeah.
Okay. Okay.
And
Amazing.
also,
Mm.
sorry to cut you off, just for me to add, the issue with bipolar is the individual that is experiencing the bipolar hasn't got the ability to regulate their moods.
Mm.
When, when you experience those sorts of extremities with moods,
Yeah.
the normal individual, I wouldn't say normal, every individual has a way of regulating their moods.
Yes.
However, people that experience bipolar haven't got the capability, or
Yeah.
at the time when they experience those mood swings, they haven't got the ability to regulate back to the normal,
Normal.
right?
Okay.
And in some countries, bipolar is not seen as a mental illness.
Okay.
So when we come to bipolar, is how society, what society deems acceptable in terms of our mood.
Mm.
Okay, so we need
Mm.
to look at that angle as well. However, where bipolar becomes problematic, like I've emphasized so many times, is when it's extreme, the person is not able to bounce back. It's
Okay.
lasted for more than a week, or more than, at least more than 4 days, and they are not able to perform the activities of daily living. Meaning living has become difficult because of these mood swings.
Swings.
Yeah.
Okay. So is that when it becomes bipolar 1 and bipolar 2?
Okay. So bipolar 1. So basically, the International Classification of Diseases is the one that has divided what is classified as type 1 bipolar, what is classified as type 2, and then
Yes.
there's another one I've always struggled to pronounce the name, the morphia. I've forgotten the name. I'll tell you.
Mm.
So type 1 is when it's lasted for more than a week,
Okay.
and the person might have experienced it several times within a year. Type
Mm.
2 is it's lasted for 4 days. However,
Wow.
it's reoccurring. So, like I said, for it to be classified as a disorder, it has it has to have lasted for more than a month, or it's
Mm.
a reoccurring issues, even with medication and psychological interventions. It's a
Intervention.
reoccurring thing.
Okay. Okay, amazing. Thank you for explaining that.
Yeah.
Um, you were saying something like in some communities they don't see bipolar as mental illness,
Yeah.
but do you think in other communities they see it as mental illness because it's few people, like is few people that have it and not all. Like if you.
Okay, so
Mm.
let me paint this picture for you. We've got one very famous person in back home where we come from. I'm not going to mention their name
Oh
for
yeah, yeah,
confidentiality purposes,
yeah.
right? Recently, that's when people noticed there was something wrong with him.
Mm,
But the behaviors and his experiences he's been exhibiting
mm,
on a national platform has always been there. However, we have seen it as someone who is always happy, right?
yeah,
And then because social media was not that popular and people didn't have access to it, then we get to see his depressive side. But to us as a community, we always notice that, oh, he's just a happy person. So you see, so then you see it's not a mental illness because here there's a lack of knowledge about
yeah.
what mental illness is. So then it's not classified as mental illness.
Mm,
I'll paint another picture. There's another community, I'm not going to mention the name, where when people are high, it's classified as enjoying life. And then when they are low, you could see the extremities of it.
mm,
Yeah. So it with bipolar is is one of a very particular kind of mental illness where
yeah.
people, it's how the society sees it. On our part of the world, we are quick to notice it because we have the knowledge to say, hey,
Yeah.
this is not normal for this person,
Mm,
right?
yeah.
And then it depends on how the bipolar was induced as
Mm,
well. So we'll come to the causes and I'll explain that a bit in
okay.
detail.
That's right. Thank you very much for that.
You're
Very
welcome.
important. What are the typical signs and symptoms people should look out for?
With bipolar, I would say, and the type of bipolar, when this person has gone to see a clinician, a professional, a consultant, and they've diagnosed him. When it comes to bipolar, there is so many types of them. Everybody's experience is different, but what
Mm,
we tend to use as a baseline symptoms will be the mania side of it. I'll give
okay.
you a typical example. There's another female celebrity well known in Ghana where when she was experiencing her mania, you find out that she's talking a lot. She's got the energy to talk. She's never tired. She's got so many thoughts. Um, she's exposing herself. She's happy, but this is not the sort of happiness you would think everybody can be happy, but not when you're happy and you're exposing yourself. You feel like you can jump over a train, you can jump over the river. And here you need to, they tend to engage in risk type of activity
That's right.
without
Yeah.
the consciousness that, okay, this might not end well.
Mm. Yeah.
Okay.
Yeah.
So you will find that. And then you have the others that might be hallucinating. That is when you find that there is psychotic or schizophrenia
Mm.
symptoms amalgamated in the mania episodes.
Yeah.
They have auditory, tactile, so many types of hallucinations come in there. And then you've got the depressive side where we all know what depression is.
Yeah.
However, some might tend to have suicidal ideation.
Mm.
So they've come from this episode of being happy, elated all over the place, and then they dip.
Mm.
Yeah. So yeah, that's some of the
The
symptoms of
signs and
bipolar. Yeah.
symptoms. Yeah. Yeah. I agree. I think now that you're talking to me, I've I've because we deal with people, so
Yeah.
I'm now understanding someone that has a bit of that. A bit
Mm.
of that. Let me ask you the next question quickly. The people are so what are the most common treatments available, both medication and therapy wise, for bipolar?
Okay. So first of all, before anyone if you are experiencing bipolar, you need to see your first point of contact will be your primary care, which is your GP. And then your GP might refer you to mental health professionals who will assess you. And from the assessment, then they can determine if you are type 1, type 2. And then from
Okay.
there, or yours is seasonal because they have people who've got
Mm,
seasonal bipolar. It's based on the season as
yeah.
well. So then, once they've done the assessment, then they can determine, okay, this is your type of bipolar. So
Mm,
with bipolar, mainly, if you like, look at the NICE guidelines. They always advise to treat with medication and
okay.
therapy.
Okay.
So medication, we've got lithium, mood stabilizers, SSR, which is serotonin
Yeah.
inhibitors. There's so many of them, and recently there's more coming out. However, what I tend to find in my line of profession is a lot of bipolar disorder tend to be treated with antipsychotic,
Mm.
depending on the person's age, depending on the side effects. It could be first generation antipsychotic or second generation.
What's the difference, please? Just quick one. First and
Okay,
second.
the first generation antipsychotic have got bad side effect.
That's when
And
they
then
become
this,
a bit
yeah,
okay.
and then the second one has mild, there is side effect. However, they tend to be mild,
Okay.
depending on the person's presentation.
Okay.
So I'll give you an example. Bipolar can be treated with one medication called Epilim Chrono. It's a mood stabilizer. Okay.
Mm.
And then you've got haloperidol, you've got risperidone, and then you've got some anticonvulsants. They are meant for epileptic seizures. However, they can be used to treat bipolar. And you're looking about something like lamotrigine. And then in terms of therapy, you've got others like cognitive behavior therapy. On the extreme side, there's ECT, which is electroconvulsion therapy. We'll talk, that is the extreme side to treat the depressive side
Yeah.
of bipolar. Yeah.
Yeah. Amazing. After they give you all this like medication, will there be a point where the person will not need the medication at all, or they will use it for life?
It depends on each
Person.
person's trajectory. Some
Okay.
people might do well with living with bipolar and managing it with medication and still be able to function in the community. There are others that might not take their medication, so then you see relapses, right? And there are others that seek spiritual healing to deal with the bipolar. So it depends on how the person or the individual is willing to engage in whatever prescribed intervention which has been allocated to them.
Okay, 100%. 100%. I agree. Okay, okay. Because I've seen some people, I think in Italy, there was a guy that had hallucination. I think it was bipolar, and they took him away for a while, and he was taking this medication, but he came back, bloated and all of that. But I think he became a bit stable.
Yeah.
He became a bit stable.
One side effect as well, like when people are on those antipsychotics, it's got a metabolic disorder because it slows down your metabolism because it's a muscle relaxant most of the time. So when you take them, they slow everything within your body down so that you'll be able to process things and not hurt yourself. So then when it comes to, if you're not someone who exercises and look at their diet carefully and check their liver functioning and all those things, you could find out that, okay, one person that, let's say, was slim and fit,
Yeah.
it's now big
Okay.
and bloated.
Yeah. Okay. 100%. I would like to ask you, so we have talked about the stabilizers, so how effective they are and how they can also be, detrimental, or how they use it to your health. But okay, so how can family and friends best support someone living with bipolar disorder?
I think first of all, if you notice your loved one has got
Sorry,
bipolar
give me a second before we go to this. This famous person in Ghana that we're talking about, I know the person. I know that there is a friend in his life that is taking him around, helping him to deal with it. Do you think that would really work, or the person would need some medication, or it depends on everybody? Yeah.
I'm going to come in the point of view as a clinician. If I was to be involved in that person's care. So first of all, the person has acknowledged that they've got bipolar disorder.
Yeah.
That's one. Two, and they are help seeking. So it takes 50% of the job off. Second, the other person that is trying to support them needs to know what bipolar is. Research and find out and gain knowledge for themselves. Because most of the time we want to support people. However, we have no clue of whatever they are going through and the type of mental illness they are going through. Okay, so I'll give you an example. You find out that back home in Ghana, when people have got epilepsy, which is abnormal electrical activity in the brain, when the person is experiencing an epileptic seizure, some people put a spoon in their mouth with the thought that they don't want them to bite their tongue. However, would you put a metal in an electric?
No.
Exactly. So because they don't have their knowledge, they want to support the person, but they don't know how to do it the right way. So for me, the most important thing is if you find out that your loved one has got bipolar, research about it. There's a wealth of resources that
That's right.
you can go into to find out what it is and how can I support them. Family support is extremely important and it contributes to the recovery of the person. However, the family needs to know what sort of mental illness they are dealing with. So that's one. Two, when they are experiencing their, let's say the person is in their mania phase, they need to look at risk and not take it lightly because at that time, that person might have the cognitive ability to assess risk for themselves and not take it that, oh, they are happy. For example, oh, we're in a home. And then they need to make
Yeah.
sure their loved ones is safe wherever that they are and support
Okay.
them.
Yeah.
And then when they come down to the depressive phase, they need to know how to support them. For
That's
me,
right.
just having the family around, knowing what bipolar is and supporting them and referring them to a crisis team or where things go to the extreme, be there
Yes.
to take them. And once they've recovered as well, the family needs to be there to support them and make sure that every step of the way they are with them.
100%. I
Yeah.
agree. And also not the, it's I think it can be a long process that they should have patience.
Yeah.
Because I've seen that the young lady that we're talking about, I think she goes and come, she'll
Mhm.
go and come, go and come. And then I think the family, they got tired, they left her to do whatever she wants. I don't know whether they got tired or whatever, but she was doing a lot. You
I
get
think
me?
I think it's not tiredness as such. It's just imagine you have a child and they are going through this, and you yourself, you don't know what it is.
The knowledge, yeah.
You don't know what it is. So you might try so many things which may
Mm,
not necessarily be the appropriate thing to do. And then you
yeah,
get tired. And for me, I feel like maybe the family does not know and they are old, yeah, they are not our generation. So
yeah,
having that form of information can be very difficult or challenging, I would say. And then in Ghana, you know where we come from, mental health is one aspect that has been put on the back
mm-hmm,
burner.
mm-hmm,
People
mm-hmm.
people focus more on the physical health side of things. If I should say someone have got high blood pressure, they know where to refer me to.
Yeah.
However, if I said I'm going through this sort of mental illness,
Yeah.
maybe the first thing they would say is go to church, go, I've seen this
Yes.
pastor, I've
Yes.
got this. But they are not looking outside the box. They are not taking maybe a biopsychosocial approach
Yes.
to that mental illness. Yeah.
I agree. We have few minutes, and I would say the last thing you just said is very important. I think, and this is funny because we have even people in abroad, like we grew up in Italy, and also in the UK that are doing the same thing. I have dealt with somebody that is a believer, a spiritual person, and I've come to, and few other people as well that are spiritual people, but I've come to know that there are certain conditions. It's not only about prayer. You just need to learn about it, as you said, study about it, and know how to deal with it. Okay, you can
Yeah.
simply be doing some breathing and breathe out exercise. When you get that anxious, you become anxious or something,
Yeah.
go for a walk. Then you have prayed. I will advise some, you have prayed and prayed and prayed. Nothing is happening. You feel like God is not listening to you. No, there are remedies, there are things that you can do. So do them and keep praying, but do them, look for help, seek for help. Because
Yeah.
sometimes you just need someone to listen to you and tell you, listen, this is what you have to do. This is what you have to do.
Yeah.
All right. So thank you. So what advice would you give to anybody that is listening before we go?
Um, for anybody that is listening, it's not necessary towards mental illness, but I would say it's about time that we took time to know ourselves. So that when something goes wrong with us physically, psychologically, we know that okay, this is not just spiritual, but something is not well. And then we know how to tackle it. So I would say people need to keep going with their self-care and get to know their self, their body, their mind, everything about you as an individual. Get to know yourself. However, I'm not saying you should, I'm a believer myself. Don't idealize yourself. Get to know yourself as a God created being, what works for you and what does not work for you. And we need to keep continuing to take care of ourselves. Our physical health and our mental health are all important.
Amazing. Thank you so much, Lady Phyllis. God bless you.
Thank
Thank
you
you
too
for
for having
joining.
me.
So much information, short but very powerful. And I
Yeah.
know that everyone that is listening to this will be blessed. I will have you soon again. Thank you and have a wonderful night. God bless
Okay,
you.
you too. My regards to
Thank you.
everyone. Bye.
Yes, thank you very much. Bye. Thank you, guys. This is Speak Out, Breaking the Silence of Abuse. You can find us on Instagram, YouTube, Facebook, Speak Out right there. And also, if you need any, help, don't hesitate to contact us. You can also check us on our website, www.speakoutout.com. We'll be waiting for you. This is Speak Out.